Welcome everyone. I am Eduardo Alcaraz Mateos from Murcia, Spain. I am presenting simulation-based training for fine needle aspiration cytology technique, a validation study. I am a pathologist at Morales Meseguer University Hospital and I collaborate with the Faculty of Medicine of the University of Murcia in the practical part of the subject through simulation. I declare I am the inventor of the simulator FioNA together with the University of Murcia, Spain, and there is an agreement license with Sorbonne. So fine needle aspiration procedure is a common technique in the daily practice at the hospital and is performed by pathologists, radiologists, and others like ENT physicians, endocrinologists, among others, based on tradition and organization of the institution. This procedure helps to diagnose lesions with morphological alterations, that is, infectious, inflammatory, or neoplastic diseases, without anesthesia and with a minimum of asepsis and antisepsis measures. A fine needle is introduced in the patient's lesion. Let me play the video. And with movements of back and forth and vacuum with the help of handles or pistols like Cameco or Aspir gun tools, patient cells are obtained and we manage this sample to prepare smears for cytological exam. Or we keep some of it apart for biochemistry, microbiological evaluation, or flow cytometry. Furthermore, some of the cells can become a cell block, that is a paraffin block, so the cytology becomes a biopsy. We perform rapid on-site evaluation to triage the sample, deciding what to do with it, and if we need more or if it's just enough for diagnosis and correct managing of the patient. In 2013, when I got involved with the university, I decided I didn't want this situation. So students with crossed arms and hands in their pockets. So the situation was that there was no simulator for fine needle aspiration procedure, so we had to perform on surgical specimens or fruits, what is even worse. So I developed this prototype for students of medicine to achieve some skills on fine needle aspiration technique. And the results of the implementation for 3 years were published in this journal. So all the students that came to our institution, they learned how to perform this procedure. Later on, I moved to different medical conferences to show the results like AMI, SESAM, or the local Spanish Society of Simulation and Patient Safety, the SESAM. And I contacted with different companies, and one of them was interested in the production, so an agreement license took place. So FioNA was born in 2018. In this paper, I include the methodology with the OSATs and with the debriefing assessment of simulation in healthcare designed by Harvard. So the simulator has been purchased by several institutions, not only in Spain but also in Europe, in Sweden, and in the United States. And several workshops have been taking place, but something was missing. I wanted to perform a validation study to know phase, content, and construct validity of the simulator. So based on these papers that were published before and taking advantage of two medical congresses, the Spanish Congress of Pathology in Granada and the European Congress of Cytology in Malmo in Sweden, we designed a validation study. It was announced through social media and during the conference, and 79 participants from 19 different countries took part in this validation study. We divided them in 4 cohorts: senior pathologists, so that is more than 10 years of experience, junior pathologists, less than 10 years of experience, residents, and also we had some medical students from the IFNSA organization, and participants faced two different scenarios with the FioNA model, with the FioNA simulator trainer, a solid lesion and a cystic one, while they were video recorded. Measured outcomes include time to complete both procedures, that is time 1 and time 2, and an objective structure assessment of technical skills checklist here, using a well-defined criteria to study construct validity. That is based on our paper published 2 years ago. A post-simulation questionnaire was complete by participants to assess phase and construct validity, only for residents, junior and senior pathologists, not for medical students. So two pathologists reviewed the recordings with the identified performance and evaluated the participants. These are the results. We found statistically significant differences in the time among the groups for the solid scenario. In this case, lower was considered better, so it was lower for junior and senior pathologists than for medical students or residents. For cystic scenario, we didn't find this. Higher expertise level was associated with better OSAT score, both in cystic and solid scenarios, both for performance aspects and the degree of emptying the cystic simulated scenario. So as you can see in the graph, you can see that the majority of the senior and junior perform a fully or moderate with some limited drainage of the cystic lesion in comparison with the medical students and the residents that most of them they have only limited drainage. Phase validity was demonstrated with an average score of 8.88 out of 10 without significantly differences among the groups. So remember, students were not included. Content validity or educational value was also proved. 92% of all participants agreed that the simulator allowed FNAC aspiration cytology training for palpation, technique, and smear preparation. There was also an agreement, perfect and good, between evaluators, up to 87% for solid lesions and 89% for cystic lesions. So concordance was important. Conclusions. This study represents the first reported validation study of a commercial simulator for FNAC. Phase, content, and construct validation were demonstrated. Thus, the simulator may be considered as a valid training tool. And standard considered features as performance time and OSAT forms may be helpful in order to define participant experience, having reproducibility regardless of the evaluator. And that's all. Thank you very much for your interest and your attention, and please stay safe in these COVID times.